Thurston County Board of Health special meeting work session. It's Wednesday, May 19th, 2021. It is 9:04 a.m. My name is Ty Menser, Chair of the Board of Health. Vice Chair Carolina Mejia. Commissioner Mejia is present, as well as Commissioner Gary Edwards, County Manager Miro Chavez, Assistant County Manager Robin Campbell, and a lot of folks from our environmental health group, including our Director of Public Health and Social Services, Shelley Slaughter. Topic for this morning is on-site sewage management plan. We have an hour slated, and this is being live streamed, I assume, Ramiro?
Yes, sir. And the live stream can be followed along on the Thurston County YouTube channel, and also the public can join us via conference call at 360-252-9020, and the PIN number is 1234.
Okay, great. Then I'm going to let Ramiro, I'm going to hand this right off to Ramiro and take us where we need to go.
I have to be respectful to Shelley, so I'll give the floor to Shelley to introduce the item, since she's the Administrator of the Board of Health.
That's right, we're Board of Health. Thank you, Shelley.
Thank you so much, Mr. Chair and County Manager Chavez. I'm actually going to go ahead and pass this briefing on over to Art Starry, our Environmental Health Division Director, to frame this issue and get us started in the interest of time. Art.
Good morning. And as Shelley mentioned, I'm Art Starry, the Environmental Health Division Director. And here with me today, besides Shelley, we've got Jane Mountjoy-Benning, who's the supervisor of our on-site sewage management program, and then Steve Peterson, who's a program manager who works primarily with on-site sewage and land use and water supply stuff, all sorts of other things, but they're kind of two key folks who are involved with this topic. And so I've asked them to be part of this. Steve looks really happy over there. Okay. So I'll just get started. I've got some slides, and if you're really pay attention, you might see that I've made some corrections with these slides over the versions that I sent you where there's some typos and things, but hopefully that won't be too distracting. So I'll start sharing my screen here. We'll go with that one. There you go. So hopefully you can see that. So what we're going to do is have again a quick review of some things that we talked about at previous briefings. The last one was in March. Follow up on some comments and questions that were made at that briefing. Talk a bit about some status of current things, and hopefully have some time for some questions afterwards. So here's some of the topics we'll go over. I mentioned a few of them before. Some basic ideas like, so why are we concerned about septic system monitoring and maintenance? What's all this fuss about? The current status of our programs, where we're doing well, maybe where we could do better. We want to talk about some options for looking at systems that don't have current inspections, and I'll talk a bit more about what we mean for that. Some other funding and legal questions that have come up. Commissioner Menser asked some things about possible options for charging people. So we've talked to legal counsel, reviewed the different laws that affect our program and on-site management plans and things. We can talk a bit about that. And also want to talk about other things that we think should be included in a good on-site sewage management plan or a good pollution control program. And then hopefully get to next steps and get some direction on where you'd like us to proceed from here. So you've seen some of this information before, and so why do we care about on-site sewage systems? As we've presented in previous briefings, they can make us sick. We've got information that shows that, of course, we know that sewage itself can have problems, and so if someone comes in contact with that, but we've had shellfish closures, we've had Vibrio, we've had norovirus actually showing up in shellfish that was traced back to on-site sewage systems. We know that if we have a failing system, it can close a shellfish bed. We had a pretty classic case of that up in Nisqually. We know that dense populations of on-site sewage systems can impact drinking water supplies. That was the example of Lacey. We have other problems associated with on-site systems. So there are a lot of good public health reasons why we want to make sure that systems don't fail. And then, of course, the big financial reason for an individual is that if you have a completely failing on-site sewage system, In these days and times, you're talking at least $15,000, $17,000 to repair it, and that's a simple repair. And if you have a more complex system, you can easily exceed $25,000. So there's a big incentive for people to protect the investment in their backyard or front yard or wherever it is. So you've seen this map before, but it just shows where the on-site sewage systems are in Thurston County. They're everywhere, but it's not surprising that they're in the more dense areas. But it's, I guess, one thing that surprises people often is that here's an area around Lacey that people consider to be kind of in the city, but there are lots and lots of on-site systems there, and so that's something that's probably warrants some attention. So current status of things, how are we doing? We've got about 54,673 on-site systems. That was the total as of January 15th. There's probably a few more of them now. 72% of them have something called a renewable operate, or 72% of them don't have any operational certificates. They're largely being monitored and maintained by citizens without a whole lot of direction or guidance from us. And then there's 28% of them that have something called a renewable operations certificate. And that's a permit that's pretty intensively managed by the health department. We send out reminders. We can penalize people if they don't comply, but we've had very good success rate with that. So 28% of that, there'll be a slide here that, well, the 15,000 or so of them, they're doing pretty well. And about 90% of those folks, or those septic system owners, are in compliance, which means they have current inspections, and then typically they're following up on any sort of problems that they see. And here's a slide that shows a bit more of that. What I'm going to do is zip forward a little bit to some different charts that show this information, then I'll come back to this slide. So again, in the marine recovery areas, so that's the Henderson area, the Nisqually area, where we have had shellfish downgrades and where we've had to implement more intensive programs to monitor and maintain on-site systems, we've had good success. So 90% of those on-site system owners are complying with the requirements in our county code and state law, and they have current inspections. And that's a really, really high rate. I think I've mentioned before, it's probably the highest rate of any large area in the Puget Sound region, considering that represents about 11,000 on-site systems. And 10% aren't conforming. Or not in their, which means that that's a regulatory word for meaning that they're not current on their inspections. There's also a bunch of on-site systems that are complex, or they're large, or they serve restaurants, and they're required to have an operational certificate by law, by our county code. And again, we've had a high success rate with those on-site systems. 87% of those systems are being properly or currently properly maintained and are current with their inspections. These systems can be required to do inspections as often as once a year, like with food service establishments, and some, probably the most of them, are every 3 years. But still, that's a very good percentage. I think that's, again, one of the higher rates in the Puget Sound region, especially for the type of program that we have. And when we compare that to what's happening in the rest of the county, we can see there's a big difference. So when we look at the on-site sewage systems, when we look at our electronic monitoring data, we see that about half of the systems are not being properly maintained. They haven't been looked at in the past 6 years. About 1/3 of them, or I guess 35%, will be precise, have been evaluated within the last 3 years, according to our septic system monitoring report. So that's not completely accurate. There's probably people who are doing a very good job of maintaining their systems who haven't hired a professional. They might have attended one of our classes. But this is the data that we have. I doubt that there's a much bigger number than 35%. And just to give you a graphic depiction of this, these are charts that we prepare every half a year, I believe it is. Jane can correct me if I'm wrong. For the Department of Health, that shows how the status of our on-site sewage system programs within the marine watersheds. Well, actually, we have them for the whole county. The map on the right is for Henderson Inlet. That's the one where we have the 90% compliance rate. And you can see all the green properties. Those are properties that are served by septic systems, and those are properties that have current inspections. And the chart on the left is Eld Inlet, and that shows kind of what it looks like with when you have about a 35 or 40% current inspection rate. So you'll see not as nearly as much green. This big red spot is a little bit deceiving. That's the Evergreen State College, and they have an on-site sewage system there for one of the properties. And so that whole thing shows as red, even though the vast majority of it's served by sewer. So that's a little deceptive. So I apologize for that. Making sense so far? I got a head nod or two. Looks like people are still going. So I'll go back to this chart that I showed you earlier. So that's number 6 on the slides. I feel so good that I actually got the slide numbers in this time. That shows that part of the reason we think that we're seeing such good results in Henderson and Nisqually and for the complex systems is because of the amount of work we're doing to make sure that people know how to monitor and maintain their systems. So we offer a lot of services. We send reminders by mail. We have workshops. We offer rebates to help people finance things. What a riser rebate is it allows someone to receive a small amount of money for putting in a septic tank riser, which is basically a manhole lid that allows easy access to their system. And there's other things that come about that help achieve these high rates. And you'll see that over in these areas, we haven't done quite so much. Now, in the case of this column, that's an enhanced program that we developed and started a few years ago with grant funding. And we offer a lot of things, but other than the renewable certificate and as much follow-up, and we've raised the rate a little bit to about 38%, but it's still quite a bit lower than 87%. Everybody with me so far? Still haven't completely adapted to these Zoom meetings where I can't see people quite so well.
I'd like to hold questions till you're done, Art, so just keep going.
Okay, I will do that. So the kind of raises the question about how do we address this? And so I went I did a lot of the work on this, but we went and looked at the on-site system management plan, and you'll probably recognize some of these things from the last presentation that we had. But so the question is, how do we address this? And the on-site management plan suggests that we send reminder notices to everybody about monitoring and maintaining their systems. That would be a big step forward because some people probably they've got other things out of sight, out of mind. Why do I want to pay $500 to get my septic tank pump when I could do something more fun with that? So that's what the advisory committee recommended. They also recommended that we again notify the owners of the needs to maintain the system. They also recommended that we have a program to, as part of this, that if there are major deficiencies that they find during the inspection process, that we set up some way to try to address that at least when the properties are sold or transferred. The plan also recommends that we have design information about all on-site systems available online. And the good news is we've made a lot of progress on that. So if you go and look at something at our website, either the county permitting website or the environmental health website, or you go visit something called Online RME, you can find your permit data and you can find design information if we have it. So that's a big success. They also recommend, though, that we have a quality assurance, quality control program. So that way, if we find problems, or I shouldn't say we, if the on-site system owner or the professional who inspects the system finds problems, that we have some ability, and they say they've corrected it, we have some quality assurance program to check on 10% or so of those to see that the people are doing the work that they've said, and to see if there's maybe ways to improve things. If you don't look, you don't know. So this would be an opportunity to check on those sorts of things. And it also recommends that we consider looking at areas where, and focus attention on areas where on-site sewage systems pose the greatest risk to public health if they fail. And that's one of the key criteria. And so that's the ideas. And so then the question kind of comes up, well, okay, so if we do these things, what are we likely to find out? What might we find or see? And this is a slide that got revised a little bit. So if you look in your packet, you might see this number is bigger. After reading this and talking to some folks, I redesigned the slide, and so I apologize for the difference. But what it does is shows what happens when you evaluate all the reports that are turned in by on-site sewage system professionals who are doing monitoring and maintenance, or what we call O&M inspections or operational certificate inspections. Is that correct, Jane? Yeah, she's nodding her head. Good, I didn't mess up on that. There's a couple different inspection types that we have, and these are the more detailed ones from on-site professionals. Yeah. And so over 2 different one-year periods, we had our data analyst look at things, and he found out that there were 14,962 inspections, or actually 18,000 inspections over that, and 14,000 of them, almost 15,000 of them, didn't have any identified deficiencies. So that's good news. But and I didn't correct this number. That's about 9%. 1,631, or about 9% of them, had deficiencies, and Jane can explain what those are. And about 8.5%, or 1,542, had serious deficiencies. So I apologize that I did that percentage is wrong. But anyways,
so I can speak a little bit about the serious deficiencies. These would be things that could indicate the system was failing. Things like surfacing sewage are noted in the comments, or a leaking tank, i.e. the tank levels are below the correct spot where it should be coming out of the tank. Might have cracked tight lines between the tank and the drain field, or between the house and the tank. So things like that in our opinion we feel like it really warrants additional follow-up to check and see what's going on with that system. We currently certainly follow up on those for the folks who have the operational certificates, but for the almost 2/3 of the rest of the county, we haven't had the capacity to follow up on those types, to necessarily follow up on those types of deficiencies as quickly or as routinely as we would like.
So thanks, Jane. So that again, if we go back to the previous slide, there's a recommendation that we try to follow up on some of those things. And so again, the serious deficiencies are the ones that are likely to either cause a public health concern or cause the system to fail. So those are the things that we would try to focus attention on. Just another way to look at this data, and I added this at the end just so you can see it, so apologize, is this. So here's another way to look at it. So that's the slice of the pie, or the 1,631 that are deficiencies, and then the serious deficiencies are about the same, close to the same number, about 8.5%. There we go. So that's a big piece of the puzzle as far as on-site sewage system management. But if you look at our plan and you look at best practices, you'll see that what you want to do in addition to finding the systems that are failing is that you want to have a program to evaluate water quality within a region on streams and things, to see if there are areas where water quality is being impaired by on-site sewage systems, or sometimes you'll find that there are other things, and that's this pollution identification and correction program, or PIC. That's considered a best practice. We have some resources to do that. Ideally, what we would like to be able to do is have regular monitoring of surface waters that are along marine, that are tributaries and surface waters, to see if we can find pollution sources, or identify stretches or areas where there's pollution, and then see if there's an on-site system component to that. So the Dobbs Creek area is an example of that, where pollution identification studies that were actually done by ecology identified that there was pollution coming from Dobbs Creek that was impacting a marine station and a shellfish harvesting area. And so now we're in the process of, having done more intensive studies, have identified that the camping club is contributing to that, and now we're working with them to fix that. So that's how the pollution identification, or PIC program, would work. Ideally, a program would have resources to make sure that we have, when problems are found, that we can work with them to solve those problems. So compliance assurance, we want to make sure that our program, at least in the marine areas, the near shore areas where septic systems are present, that we have the ability to do dye tracing. And we've talked about this before, but that's a program where during the wet part of the year, our staff make appointments, talk to the property owners, and introduce fluorescein dye into the toilet or into sinks. And we have ways then to determine whether the dye surfaces on the surface of the ground or is released to the bulkhead or the bank, to see whether or not, again, dye that was flushed down the toilet is making it to the surface of the ground. And then we follow that up with bacteriological testing to make sure that it truly is sewage and it's a public health concern. But if it meets both of those criteria, in other words, it has dye and high levels of bacteria coming out, then that's a failure, and we would work to fix that. So that's found a lot of on-site systems that were failing along the shorelines that probably wouldn't have been noticed for a long time. And of course, a big piece to this is trying to have education and outreach, so that way people can know what to do, so that they can monitor and maintain their system properly and protect their investment and protect public health. So when we talked previously, there's some questions about, how could we go about doing this? Right now, environmental health programs are paid with fees and grants, and there are some internal transfers of funds for specific purposes, but we have very little discretionary income. And what we found when we're looking at these programs is that when you're doing billing for fees, especially for things that people maybe don't really want to do, that it tends to be a pretty inefficient process. When we do billing for on-site stuff, for the operational certificates, and send notices, about 50% of the people comply the first time. And then when we send a second notice, we get about 50% more. And then the third time we'll get a few more. And then that's kind of as far as we're going to get. So it tends to be a fairly intensive process, even for people who know what they're supposed to be doing for monitoring and maintaining their systems. Grants can be difficult. We're very good at getting grants, but they take a lot of time. The problem is that they also are very competitive, and they take time to administer, as our finance folks can tell you with all the reporting, and Jane could certainly tell you. And they almost inevitably are reactive. In other words, you get a grant after you've found a problem and now you're trying to fix it. It's hard to be proactive with grants. We've been successful in some areas, but a lot of times we're after the fact. So for instance, the grant for Dobbs Creek, we started that years ago, and actually we obtained it a few years ago, and we actually had to start applying years before that. Same with the education and outreach program for Eld Inlet. It's a pretty long and laborious process, but we're good at it. It just takes time. And then finding resources to front load a program can be challenging, and they're kind of few and far between. So that can be a challenge. So one of the things we talked about previously was, is there a way to send out notices to folks and then charge folks who don't cooperate or comply? That's a possibility, but then we would need to find the funding source to pay for that up front. So that's my attempt at being clever by putting a front loader on there. Some other things to consider are some of the limitations of state law, and this is where we met with Jane Futterman to review this and just make sure we understood what the limitations are, at least fairly well. So when you look at the state law, and in the packet I gave you, it actually lists the RCW that addresses these different things. But the one that governs local Board of Health's ability to charge fees for services, it says that the fees they're limited to the amount of the cost of delivering that service or providing that service. You can't go and basically make extra money from one person in order to pay for a service that you're providing to another. There needs to be, you can't overcharge. There needs to be a relationship. It does allow us to assess rates and charges, or you can call them fees, via the property tax statement to implement the septic system management plan. But it needs, whatever you're doing needs to actually be included in the plan. So if we wanted to do something that was different than what's in the current plan, we would need to have the plan amended, and then we could charge for that. However, the good thing about that state law is it does give us quite a bit of latitude for what we can do if something's included in the plan. So there can be compliance elements, there can be education and outreach, there can be pollution identification and control or correction efforts, again, but they need to be in the plan. And just a reminder that if we do any sort of plan amendments or to approve a plan in the first place, it needs to be done by you acting as the Board of Health, and it needs to be after a public hearing. So it's not something that, after this meeting, we could just decide to go ahead and do and add some elements and use your authority to charge fees unless it was in the plan, if we're using that special property tax authority. And I mentioned this before. So one of the things that with environmental health is we're pretty tight as far as our ability to fund things with discretionary funding. We have a little bit that deals with compliance, and I think at a briefing when Jane talked to you about the Lakes program a bit ago, we talked about how a little bit of general fund is being used for paying for some lakes monitoring, but that's about it. I mean, actually bathing beach stuff, there's not a whole lot more than that. Let's see, Robin isn't shaking her head or anything, so good. I'm not getting too far off. And then just a reminder that when we're talking about water quality issues, that septic systems aren't the only issue. There's a lot of other pieces to the puzzle, and it tends to vary depending upon what watershed you're in and what the land use practices are and whatnot. But there can be a whole variety of things, and I could have made a bigger puzzle if I knew how. But here's some key things that you've probably all heard about and are familiar with. And so, and depending upon the watershed, you'll see there are different things. So when we talk about the upper Deschutes, it's one thing. If we talk about, the urban area or growth management area or the shellfish harvesting area in Henderson Inlet, it's a different mix of things. And so then now just to kind of refresh our memories a bit about some of the key things that are in the plan and what we're working on is the plan recommends that we continue Henderson and Nisqually, which we're doing. And again, thanks for renewing the Henderson program. We'll be, depending on what happens in the future, we'll most likely be coming back to renew the Nisqually program here in a couple of years, or probably start it next year. It expires in 2023 unless you renew it. Continue having programs for the large and complex systems that require operational certificates currently. The plan also recommends that we develop programs for the other high-risk areas in Thurston County, and it calls out specifically Summit Lake and Eld Inlet. Eld Inlet has had some water quality problems periodically. Years ago, it had a major shellfish downgrade, which resulted in closures, and we started a program there about the time I got hired. Tells you how old it is. And then I mentioned Summit Lake. Implement programs to help educate and inform people about what they need to do and continue things with like riser rebates and whatnot if we can provide funding for them. And then again, it recommends the PIC program. So, and just quickly go over a few concepts that might be possible for fees or charges. One thing we could do, and we talked talking to Steve and Jane and I, and also to the other Jane Futterman, it would be possible to have a base fee or something, and then it could be, if someone wasn't in compliance, it could be possible to add an additional charge for that whatever's needed to work with them to bring them into compliance. So that's a sort of a concept that Commissioner Mentzer mentioned before, not exactly. So we could have a compliance fee. It can't be an outright penalty like a civil penalty that tend to be punitive, but it could be an additional charge for people who are basically taking more of our time in order to get them to help them maintain their systems and to come into compliance. The fee charge concept could include the pollution identification and correction program to pay for surveys and investigations and water quality efforts. However, if we're charging that using the authority from the OnSite plan, it needs to be related to OnSite. And it also recommends that the property tax statement be utilized. So then, and what we found, and after talking to stakeholders, is that that is the most efficient way to do it. And when people think about the time and effort it takes to send bills and pay for stamps and things, that is an efficient way to do it. And we do a good job doing monitoring and maintenance, doing billing and all that sort of stuff is more challenging. Whereas the treasurer's office and the assessor or treasurer is really good at that.
Yeah, it also puts your folks who are trained in the septic maintenance and the health aspects into the role of being the bill collectors, which is not our talent. Yeah, it's just not the most efficient way to go.
Oops, sorry, went too far. So where do we want to go from here? So that's slide I borrowed again from last time. And it kind of, again, kind of the options we talked about previously, and they're just summarized here, are, we could continue to do what we're doing. We're thanks to some grants and some other things and your authorization, we're approaching full staffing. And so we're making good progress on Henderson and Nisqually and keeping things going. We could continue to do that. We could continue to look for grants. We could continue to use our time of transfer reports. Those are those things that happen when someone sells their property. They need to have their system evaluated, and that gives us a good chance to identify problems and correct those or work with the property owner to do that. So we can continue that. And again, we're making good progress in some areas, but it doesn't really address the 40,000 or so on-site systems that, well, I guess it addresses some of them when they sell, but it doesn't provide a proactive program to help people monitor and maintain their systems and provide them with the information they need. We could implement the management plan, and I highlighted some of the key things for that. Again, and trying to identify key areas, doing enhanced education and outreach, continue looking to implement more advanced programs in high need areas or high risk areas. And then the third thing would be some sort of hybrid. And there could probably be a bunch of different hybrids that trying to blend different things. And so not knowing exactly what the best approach might be or what your preferences are, we could do that. So we could try to look at more programs for high-risk shorelines and have education throughout the rest of the county. We could do any of a number of different things. That would be part of, I guess, the discussion that we hope to have here in the next few seconds, if I can just be quiet. And so really that's the presentation I have and the information we have. And so I want to thank you for your interest in this. And if people have any questions, we're watching this, there's my contact information. But Steve, Jane, Shelley, and I thank you, and want to see what questions you have.
Can you stop sharing screen, Art, so I can see?
I will do that.
Start with Commissioner Mejia.
Thank you. Okay, so with the options that you've laid out, Art, for us, is there like a price range that goes with that? Is there a price tag that goes with it? I mean, how are these programs funded?
So when the program was budgeted to implement the on-site plan in 2016, it was about $2.6 million all told. Now that included things that aren't, that included incorporating the time of transfer program into, or covering those costs with the charges for the plan. It included some pollution identification and correction. And if that represented about a $45 charge for every on-site system in Thurston County. So that was the big plan then, and if you adjust that for inflation, it's going to be at least another 10%. I didn't rework all the numbers on that. I could certainly do that if you would like, but those were the ranges from back then. And that was implementing the plan as proposed. Then there was a second option that was developed at the request of the board that had a tiered program, which had elements that would focus on the marine areas or the high risk areas. And they would receive basically the sort of service we're providing to Henderson and Nisqually. Then there was an intermediate tier that would be the watersheds that are marine watersheds. They would receive education and outreach, and there'd be monitoring going on. They wouldn't be the dye tracing, but it'd be an intermediate level of service. And then for the rest of the county, we called it the Chehalis watershed or the South County. They would be charged a smaller amount, and that would be to, again, do the sort of thing we've been talking about. So do mailings and provide workshops and things, but not have as specific a monitoring and maintenance program. This wouldn't have the same level of follow-up. And that was 3 tiers, and it turned out, I think they were $19, $38, and whatever, 38 plus, that's 67. So those were the 3 programs from then. They were, again, designed to recover the same amount of revenue.
And those were all annual figures of those.
Those were annual fees, yes. Yeah. And so that compares to right now in Henderson or Nisqually, the low risk system is about $45. A high risk system is going to be paying over $170 per year. And that's one that's going to be a shoreline property that has dye trace. And then time of transfer program, Steve could probably tell me the exact fee now, but it's in the $265 range.
250.
250. So that was what the advisory committee came up with. They thought, and as it turned out, a lot of people didn't agree, but the idea was that if you provided all these services and for those charges, that would be a benefit to the public, and people would think that was a good deal. That ultimately that wasn't approved. That the funding for that program or that element of the program.
Thank you.
I'm going to ask a question on that because it's on the exact same topic. So following on, wasn't then there a $10 fee compromise made? And I'm wondering, what was that intended to fund when the board decided to just go with $10 flat?
So that was developed by the majority of the board in an attempt to provide some funding for the on-site management plan. So the plan was approved at a hearing, but then again, I think I showed the slide of the busy meeting room, or the commissioners meeting room, where many folks were still concerned. So the board, as a compromise majority, adopted a $10 per year fee for all on-site systems that were outside of Henderson and Nisqually and didn't already have an operational certificate. And the idea was to use that funding to actually do the things that were recommended in the plan. So doing mailings, doing education and outreach, doing some limited pollution identification and correction, I believe. So it was a very scaled back program. The time of transfer, the other things that were included in the original proposal would have been taken out. We would have basically implemented what we could, as best we could, using the $10 charge, which would have generated probably in the neighborhood of $400,000 a year.
And then one more funding question, then I'll pass it to my CMate and circle back. The fee would have gone, like when you're showing the maps, you're showing the whole county. So as a Board of Health, we would have been able to impose these on septics within City of Lacey, for example?
Yes. As
Okay.
the Board of Health, you have authority over all the on-site systems. So you could impose that.
Okay, so I'm going to stop there because that was just a follow-up to Commissioner Mejia. I'll go to Commissioner Edwards, and then I have some other ones after that. Go ahead, Commissioner Edwards.
Art, how are we coming on the Dobbs Creek correction area?
I will defer to Jane, who's been working on that very hard.
Yeah, we're making good progress. So we had to do a very extensive records review and look back at codes in place at the time that the original campground was permitted. So that took, and then work with our legal folks about what we could and could not require. That took quite a while. So that's all done. We sent them a compliance letter, and they are working now on. They're being proactive. They're working with us. They're working on getting a septic designer or an engineer on board to help them come up with some kind of system that could be permitted. They're having a little trouble finding somebody who is willing to take on the project. So they are working on that. We do have some funding through grants that is time limited to help support the cost share, a little bit of the fees involved with hiring the designer and getting the permitting going. So they're aware of that time pressure and are making progress. They're also now putting systems in place that we will be approving to more regularly themselves do a check of, is everybody's drain hose hooked up to some kind of a catchment system of some sort, a tank or something, and making sure that that's happening as it should be in the interim until we can get the systems replaced with something that can be permitted.
Okay. Hey, Art, you mentioned that we have a higher rate of compliance than other areas. Could you give us some figures along with that? I've heard figures in the past that were substantially better than most of the counties around here.
Yeah, so there's I won't try to pull it up now, but there's a slide from the State Department of Health that shows the overall percentage of systems that have current inspections in the Puget Sound area. So that's the 12 Puget Sound counties. And that's been improving slowly, but in aggregate, it's less than 50%. It's about 48%, I think. And that includes us. So they're getting a little bit of a boost from us because we've got, 15,000 systems 12,000 systems in the marine watershed areas that are, at 90%. So, and that's within the high risk areas. And so that's the Hendersons and the Nisquallies of the Puget Sound area. So,
but the bottom line is we're doing substantially better than these other.
In our Henderson and Nisqually areas, we are doing, and I say we, I mean Jane and Steve and their staff are doing really, really well.
What's different between when you gathered information and presented it in 2016 compared to the information that you're giving us today, other than there's a few more systems, I guess, but is there some major things that have happened, or good, bad, or indifferent, relatively the same other than numbers? What's going on?
So it's a lot of this, I've done so many variations on these presentations, it's hard to keep track of them all. But as far as the on-site plan, the same elements are the same. I mean, the key elements of it are the same. The difference I guess the big difference is that when the funding for the on-site plan was repealed, we were fortunate enough to apply for the grant that allowed us to do special emphasis education and outreach in ELD, primarily in ELD Inlet, but there's some other areas. And so that was I guess that's a big difference. So now we have that information that shows that with a tremendous amount of effort and mailings and workshops and rebates and other things, how far the needle moves on that. And I could go back and show you that slide again, but it shows that we can make some progress, but we don't achieve the same level of success that we do with the Henderson and Nisqually program. So I think that's probably a big difference between now and then. We now have that information. And that was, we were wanted to really test how far could we go with education and outreach. And that's where we are currently.
Can you show that again?
Go ahead.
On Commissioner Edwards' point, can you show what you just referred to?
Excuse me again?
You said you're able to show what the education and outreach efforts yielded in terms of moving the needle. And
So, yeah, so I'll go back to that slide.
While he's doing that, that was basically the board at that time wanted to see with a non-regulatory approach, but an education outreach approach where people generally don't want their systems to fail, right? So that they felt like giving them a little more education would result in people taking the right steps, compared to requiring that they happen. And we found that we can get, again, our trying to countywide maybe about half of the people would be having their systems inspected at least every 3 years. Well, at least every 6 years, I guess I would say.
Yeah, so this slide shows, it's one of the slide sets that we have on that. And so it shows again, in 3 years, things improved a fair amount. And this education program, besides having workshops and things, there were mailings, and the mailings even said, when, according to our records, when was the last time the system was maintained? So it wasn't just a general, gosh, it would be good for you to evaluate your system. It was, well, the last records we have are from 2006 or whatever the date was. And so
yeah, we only mailed to people who we had no records indicating that any maintenance was done or inspections within the last 6 years.
And how does this slide compare to slide 6? Can you explain the difference? When you've got the 38% there and 35, what is that? How does that connect to the pie chart you showed?
Mm-hmm.
So, oops, but the slight difference here. So this slide was, we had another slide before that showed specifically for the ELD stuff, and it was 38%, and the 35% is kind of the aggregate, I believe. Oops, I went too far. Sorry. So that's it.
Yeah,
so,
and that the difference is whether you're looking at every 3 years as state law requires, or again, our general education says if you don't, we recommend you inspect your system every year, pumping it when it needs it. If you just really are never going to do that, then most families need to pump every 3 to 5 years. So every 3 years is that dark blue. We went ahead and let's look and see what happened after 6 years to catch those people who might have, done the pumping at a 5 year or 6 year interval. So you get a few more. So that the dark red is really, really not current, could include the red and the light blue. So the numbers are more similar than they first look.
And I'm just looking at on slide 6, it seems like what I was reading that to be is that the difference between 35 and 38, that's being a product of what that education effort yielded.
So yeah, what happened, I think there's a couple of things that went on. So the 38%, and there's another slide that I didn't put in this set, that shows specifically for ELD, and it showed that within that ELD area, I think it got up to 38%. At the same time, the overall county rate went up to 35%.
I think this included not, I'd have to go back at this point and check, but it was just by chance. We had the grant to focus in on ELD and do this enhanced outreach. At the same time, the lake manager, or the special district around Black Lake was interested in doing a similar project, and there were folks up at Summit Lake who were also interested in having such a thing. So those entities did their own enhanced education and asked us to look at those rates. So I think that 38% may be a combined number of Eld and Black and Summit Lake, and the changes that they made based on enhanced education and outreach. I do recall that I think the Eld inlet numbers were a little bit higher. The Black Lake was kind of in the middle, and the Summit Lake was, surprising to me, was the lowest. I think that would be a really high, an area of high concern because of the drinking water. I was surprised that they didn't get as much compliance, or or as much work of the enhanced maintenance as one would hope.
Sorry to interrupt you, Commissioner Edwards. Go ahead.
No, that's fine. We're still putting pharmaceuticals and whatnot in Eldon Inlet, though, right? From the municipal sewer system that we have down there, lot. They're not doing anything to take that out yet, are they?
So right now today, the lot is not employing anything additional for treatment for pharmaceuticals. That study is still ongoing. The lot treatment process reduces some things or some residual chemicals quite a bit, but others it does not. And that's ongoing work. Hopefully someday soon it'll get done and there'll be another presentation for you on that.
Okay. I don't know, I guess that's about it for me. I have to say, I mean, slide 9 is kind of telling, I think, as far as people want their septic systems to work properly. And if you educate people, they continue to make advancements in protecting the environment. And I have to say, I don't think we need to start taxing people more to get them to do more. I think compliance comes through when you work with people and educate people. And we had some numbers that were kind of skewed back in 16. I've got some material I could get out to the board members if they wanted to see that. But I think all in all, staff's doing a good job and the citizens are doing a good job trying to keep their own areas functioning properly. And I do think that our point in time process, is that still 7 years that we're thinking most places get a review? Or is because of the real estate market being so hot, is that number coming down? Or
I suspect it is, but the last number I had was about on average homes sell every 7 years, but that is an older number.
Yeah. Okay. Thank you.
We probably have Greg Moe or someone like that give you a good number.
Yeah. Okay. Thanks.
Okay. Not sure, we've got just a couple of minutes. Just to clarify, you mentioned a couple of times that I had made a mention of a base. You made reference to me and what you described as a base fee system, and that was not, I just want to clarify for the record, that was not my concept. I was searching for a way to get a better compliance rate without, having to resort to different fee mechanisms that had been unpopular in the past. Maybe it's not possible, but I was just trying to, brainstorm on that.
Oh, sorry if I made it seem, sorry.
That's okay. No, it's fair. I just want to clarify because people are listening. My thought process was about the fact that, learning that state law required, folks to do things within a 3-year time interval. And can we just sort of be rather than it being a county imposed, fee, could it be something that we do a better job of following up with, whatever that looks like, from postcards to a penalty system that, for non-compliance, but that was, that's just where I was at, and I know there's issues there as well. One question, I'm just looking at questions I wrote down. When we looked at those stats about the inspections and the deficiencies versus serious deficiencies, are serious deficiencies, I know I'm sure it's a grab bag, as Gene explained, of different things, but by and large, are those things that are due to neglect, like they could have been avoided had there been regular maintenance, or are these systems such that you're going to have serious, even with proper maintenance, you're going to have serious deficiencies, regardless of whether you're doing your pumping and inspection?
I would say it's a mix. So, for example, a deficiency that we wouldn't that does not show up on the serious deficiency list, though if you had an operational certificate, we would make you fix it, is if you have no baffles or your baffle is broken, so that baffle at the end of your septic system or end of your septic tank helps keep solids from entering your drain field. So if that baffle's not working, then you have a higher risk of clogging your drain field and making it fail. So had you been doing regular inspections and caught that broken baffle, which is one of the more common deficiencies we find in the Henderson and Nisqually situation, then you may have prevented a surfacing sewage because of a failed drain field. So the surfacing sewage would show up on the serious deficiencies list. The baffle, broken baffle, or would show up on the regular deficiency list.
And I know we're out of time, and ask one more question. If for the folks that are in the 28% that require operational certificates, are they? I'm trying to figure out in terms of that citizen, what are they paying to whom that the person that's not doing what they're not doing their maintenance or routine are paying. I mean, there's like it's $42 or whatever if you're in the shellfish protection area, but then they're actually getting their inspection. That costs, whatever. I think I costed that out. That's a few $100s every so often. And then are there other fees that we're imposing? I mean,
well, yeah.
If we required the 72% of the people that don't have that ROC requirement to have the ROC requirement, what would that mean?
Right. So currently we're running really, 3 different programs, maybe 4. So if you're in the marine recovery area, the Henderson Nisqually, you're paying an annual rate and charge on your tax statement that are described. If you're elsewhere in the county because you have a complex system, you're paying an operational certificate fee, which currently is $155. Most of those happen every 3 years. Some of those happen every year for the really complex systems. So those are the ones who probably call you up, and they sure call me up, who are upset because they're having to pay this for their relatively new system. The neighbor down the road who has a 40-year-old system and they've never seen a septic pumping company out there, doesn't pay anything. So they have that fee that they pay us. They have to pay for their inspection. In Henderson and Nisqually, we've been able to certify people to do that inspection themselves for the more simple systems. The complex systems can't do that. If they need pumping, of course, they have to pump. Some of the very complex systems then may require quarterly effluent sampling because of, again, if they require disinfection or they're really high-risk systems, they may have those additional fees as well. And that would be paid to the septic professional.
Shelley, we are out of time and we have another briefing. What do you, I don't know what we need to do to just set the next step, if anything. I mean, I guess the board, I guess I'm going to propose that we just have the board, this be brought maybe on a Tuesday morning or a Thursday morning, that we can sort of have a follow-up discussion. I don't know, we're out of time right now.
I could help on that, Shelley, if you like.
Yes, thank you, Ramiro.
Yes, the commissioners, you have been provided three options for you. Is the status quo, consider fees within included on the on-site sewage management plan, in a combination which hybrid, something in between. So I will bring this for your consideration to weigh in on the 3 options this next Tuesday morning during your agenda setting, and we'll schedule that as a special Board of Health meeting, obviously. And if on the second option, fees includes an LSS, if that's the direction of the board, just want to clarify, you're not assuming on a specific fee will give us the direction as to explore what that is. and bring back an option. So those are the three options for you, and I will bring those on Tuesday.
Chair, I'd like to make a suggestion.
Sure.
I think if we're going to think about doing something here, we ought to have a public hearing, and then you can see what the public thinks as we move forward, and we'll bring out some real numbers and explain. But I believe that I've been there in the 16 hearing dates and such. You'll see what the public really thinks about this, and that the public feels that this education piece is a much better way to go than trying to do additional taxes on citizens without real justification if you compare us to others. So before we make any decisions about moving forward, I would suggest that we have a public hearing, see what the community has to say about this.
And if I may, that's a good point what Commissioner Edwards brings. If the board decides on option number 2, you're not approving a fee. You're moving forward in a process to hold a public hearing. So because you will not be able to take any action in approving a fee without having a public hearing.
My problem with all of this is that I'm guessing that where I land would fall within the umbrella of the hybrid, which doesn't give us any clear answers, because then that just opens a door for, well, then what elements are we going to include and how, I mean, so it's not just easy for me to go, yes, that's the answer. That's not the answer. I think there's an answer out there, but I just don't think it's dialed up right in front of us for the reasons that both Art and Commissioner Edwards have described this morning. So we're just going to have to keep working on it. But I think we need to figure out whether the board wants to, what direction we want to go to try to get to a proposal that we think could garner support of the community.
Yeah. Or maybe I can have another option for you on a fourth option on Tuesday, is to ask staff to come back with a little more details on options number 2 and number 3.
Okay, that sounds logical.
Yeah, I'll bring that as well. Okay, thank you.
We're going to break for today. Thanks, everybody. We'll give ourselves a couple minutes to get into the water sewer construction material standards update briefing.
Thank you.
Thank you.